Computer. So hypertension or high blood pressure is a huge problem worldwide, and it is called a silent killer because very often we don't have any symptoms. In fact, the first time I was diagnosed, this was 18, 19 years ago, I was undergoing a hysterectomy surgery, and on the OR table, in the OR, on the table, my blood pressure went up. And of course, during a surgery, blood pressures are monitored by the anesthetist. So, very often, I'm sure many of you have had this experience. You don't have any symptoms, you go to the doctor, and as it routinely is done, your doctor checks your blood pressure and tells you, I think your blood pressure is higher than it should be. And the other thing is, most of us don't usually go to a doctor unless we have a problem or unless we are so disciplined that every year, we go regularly to the doctor, or you have a home blood pressure device. That is how my husband diagnosed my brother-in-law's hypertension. My husband's not a doctor. He was just playing around with the home blood pressure device, and he told my brother-in-law, his brothers, oh, just sit down here, I'll just check your blood pressure. And it turned out to be very high. And he had no, when we say no symptoms, sometimes we may even miss those symptoms. So sometimes things like, headache, severe headache, fatigue, or just not feeling well, people have reported those symptoms, but sometimes we don't give a lot of importance to those. And some studies have shown that, after the hypertension was treated and blood pressure came down to normal, some of those symptoms went away. And particularly in women, often those symptoms have also been dismissed as, oh, that's just your menopausal transition. So I am going to start sharing my slide. So the reason, high blood pressure is such a big problem is because of its silent nature. There is no obvious symptom very often. And with the result that a lot of people don't have their blood pressure checked. And particularly majorly concerning is the high numbers of young people with high blood pressure nowadays, even in children. So pediatric population, and many a time I don't think children's blood pressure have been checked if they go for a routine checkup or some, any visit to the pediatrician, but it is becoming more and more important because high blood pressure is showing up in younger and younger people. Of course, there are many reasons. There is no one single reason. And one of the major factors is, of course, our metabolic dysfunction. So, why more than 1 billion people worldwide? So, that is 1/8 the world population has high blood pressure. Of them, many of them don't even know it. So 46% of people don't even know. And you could be sitting in the audience today and thinking, oh, am I one of them? So when was the last time you had your blood pressure checked? So 46% of people are not aware. And what is also very alarming is of those people who know they have hypertension and they are on treatment, their blood pressure is not at the optimal range at which it should be. And studies have shown that if you are on treatment, but your blood pressure is still not at the optimal range, and I will talk about ranges. And before anything else, I should have said this at the beginning. None of this is medical advice. You need to talk to your healthcare professional. I am going to provide you with information that you can take action on. And, having better knowledge is always, more important for you because health doesn't always happen at the doctor's clinic, but for you to have a better conversation with your doctor, you need to know what you want to talk about. So, going back to of those people, so some of you in the audience, I'm 100% sure it is true because my patients tell me, no, my blood pressure is normal. And I have to ask them, what is your definition of normal? So if you are on treatment, but your blood pressure is not at the target at which it should be, it is as bad as not being on treatment. Now, that is significant because you may be thinking, I'm taking my medications regularly. I go for my checkup regularly to the doctor's clinic. And I'll talk about how measuring your blood pressure just once at the doctor's clinic is often not enough. So, what are the possible damages from untreated high blood pressure or undertreated high blood pressure. You can see the consequences are very serious in higher stroke, dementia, heart failure, everything you name, loss of vision, sexual dysfunction. This is something that usually gets the attention of my younger patients because they are not really thinking of heart attack and stroke and dementia. For them, that's like, oh, that's what happens to my parents or grandparents. And some weeks ago, I was showing this slide to somebody because I said, how big a problem hypertension is, and it is not managed as well as it should be. And she shared a very sad story about her husband who went to the ER because of some minor injury. And there they found he had high blood pressure, and he was in his late 30s. And he had had high blood pressure for a long time. He didn't know, he didn't think he had any symptoms. And in a very short time, he already had what we call end organ damage. That means his kidneys were damaged, his vision was impaired, and in a very short span of time, he passed away. So that's a really sad story. And she told me, if someone had shown us this slide back then, when we didn't know he had high blood pressure, things would have been quite different. And that was like really sad. So how is high blood pressure or hypertension diagnosed? Most of the time, as I said, either you went to your doctor, you had your blood pressure checked, and the doctor said, okay, your blood pressure is high. But recent guidelines are recommending that the best way to know whether you have high blood pressure is what is called out of office blood pressure measurement. So out of office meaning out of the doctor's office. Now there are many different ways of doing it. One is home blood pressure monitoring. This is you wear a device with an upper arm cuff, and I'm sure many of you have those devices at home. Just make sure that, in the ideal world, you would get it calibrated at your doctor's office maybe once in a year or once in 6 months. Or you could also look for already clinically validated devices because there are gazillions of devices available. I mean, they start from $40 to I think maximum of $200 or $300. And just because a device is more expensive doesn't necessarily always mean it's always clinically validated. So clinically validated meaning that blood pressure has been tested as compared to a standard blood pressure device that is used in clinics or in research facilities. Now, the next is 24-hour ambulatory blood pressure measurement. That is extremely important because basically what happens in that, now there are different ways of doing the 24-hour ambulatory. The commonest one, which is available all over the world, is you wear a cuff device for 24 hours and you have that monitor, this is across, you hang it like that. You wear it for 24 hours, and every half an hour or so, the cuff will inflate and check your blood pressure. The important thing that happens with a 24-hour ambulatory blood pressure measurement is it can check your blood pressure when you're going through your normal, regular, everyday life. You're walking, driving, working. And more importantly, it can check your nighttime blood pressure. Now, we know in recent years there have been many studies which have shown that if your blood pressure is normal throughout the day, but it is high at night, or more importantly, there is something called non-dipper status. Now, non-dipper means normally blood pressure is supposed to fall by about 10% at night. If it does not fall, even if your blood pressure is normal for the rest of the day, that still raises your risk for stroke and dementia and heart disease and all of that. So a 24-hour ambulatory blood pressure test can also tell you about your nighttime blood pressure because your home blood pressure device, even if you check 4 or 5 times in the day, you're not checking it when you're asleep. The newer devices, which is what I'm very excited about, this is what I have been using for a while now. It's called Actia. It can be worn 24/7. It's a wearable device. And it is it's very new. It's not available all over the world yet, but it will be very soon. Now, those of you, I know many of you in my audience today are from Europe. So it is available in Europe, UK, Switzerland, Germany, and you can actually check on their website. It is not available in North America yet, but it will be very soon. So I am excited. And Actia has not paid me to talk about it, but I improved my blood pressure using this device because, again, I am sure many of you will relate to this experience of mine. I have a home blood pressure device, but this is where I'm going to talk about how it's quite an irksome process measuring your blood pressure at home. I'll come to that very soon, and how small changes of things like not having both your feet planted firmly on the ground, not resting for 5 minutes, how those apparently small things can make a huge difference in your readings. I know some of you you receive my newsletters every week, and I will post a link for those who don't receive my newsletters yet. Last week, I talked about how hand positions, where the hand is, supported or not supported, just hanging on the side, how those things like hand positions make a difference in the readings. Then, very interestingly, just 2 days ago, Actia also announced that they are going to have, on the phone it hasn't been launched yet, so I don't know. It's probably going to be something like, you put your finger on the phone and it can check your blood pressure. There was another company which measured blood pressure from, selfies, but I don't see them measuring blood pressure now. I don't know what happened. So my point is there are lots of interesting, wonderful tools coming down the line. Then there are some watches as well, and I had tried one a few years ago. It was not correct. But all those things. So what is different about a device like this is you put it on once and it continues to measure blood pressure in the background. Of course, your arm has to be rested versus you having to take action every time. Now, the 24-hour ambulatory blood pressure test that is done at the doctor's clinic is at least in Alberta, it is not done by the family doctor. You have to get a reference to the cardiologist. Different parts of the world, it is different things. In countries like India, people can just go to the local hospital which has this service and ask for it. Whereas in most other countries in the world, you will need a doctor's prescription. And for a device like this, you don't need to take action all the time. So even if the phone app comes, it's good to check, once in a while, you're just sitting watching TV and you decide to check it, but it still needs action from you. So I'm always for, making things simpler and easier for people to stick to rather than relying on, people taking action all the time. Because, all of us have busy lives. I mean, how many of you are really thinking, unless you have some symptoms and you're majorly concerned, like, oh, I need to check my blood pressure today 3 times or 4 times a day. So, out of office blood pressure measurement, meaning checking your blood pressure outside the doctor's clinic, is what is the standard of care now. Now, I know it is not implemented everywhere as yet. And so the thing is, the point I want to highlight here is what is the action that you can take? Let us say a device like Actia is not available in your country yet. But everyone all over the world has access to home blood pressure measurement devices. And I would suggest that is probably one of the best investments for your health and your family's health as well. So the next thing is, like I said, the process of measuring blood pressure at home using these upper arm cuff devices is kind of irksome. So here you can see your back has to be supported, both feet flat on the floor. You have to be relaxed for 3 to 5 minutes. And I can tell you, I mean, I'm like looking at my watch. Is it 5 minutes? No, it's just 2 minutes. How long do I have to sit like this? Maybe I should do it after my meditation. So many different ways. And I told myself, I'm a tiny habits coach. I should be able to figure this out. But I can tell you, I would ask my patients to check their blood pressure morning, afternoon, evening for at least a week, but I did not succeed in doing it. And while I was struggling with all this, Actia came up with the device, so I was super happy. because then I didn't have to constantly do something about measuring my blood pressure. Now, the room has to be quiet and comfortable. In fact, actually, even at your doctor's clinic, the device that is supposed to be used is supposed to be an automatic device, and you are supposed to be left alone by yourself. So, even having someone in the room, and particularly if that person is talking to you, can change your blood pressure numbers. So you understand. So feet firmly planted on the ground, back supported, arm supported at the arm is bare and resting. No, it's not over clothes. And the cuff size is very important. It should cover at least 75 to 100% of the entire arm, the cuff part of it, the inflation part of it. No talking, empty bladder, no smoking, no coffee, no exercise for 30 minutes. So you understand that this is not a simple, easy way always. And each of these things, and believe you me, I was in med school a long time ago. Recently, I sent a message to my med school WhatsApp group. I said, how many of us will actually pass a blood pressure testing test today? I don't remember all of us, doing all these things regularly when we check blood pressure. And I'm sure you've had similar experience at your doctor's clinic as well. One of my neighborhood pharmacies has one of those, little units where you can sit and check your blood pressure. It did not have a back support. And I asked the pharmacist, I said, what is this? Like, I'm not going to name the pharmacy, but you understand what I mean. A lot of people are either not aware or they feel, oh, it's not a big deal. So is it not a big deal? So this is again, this was office blood pressure readings, but it's similar in when you measure blood pressure at home. So you can see some of this like bladder extension. If you have a full bladder, your blood pressure readings can go up to plus 33, plus 4 to plus 33. Cold exposure, yes, winter blood pressure can go up. Standing, lying, clinical office setting. This is something called white coat hypertension, where the blood pressure readings in the doctor's clinic, doctor's office are higher than the measurements at home. So that is the reason out of office blood pressure measurement is so important. Unsupported arm, now legs crossed at knees. So the important question here is if you have a full bladder and legs are crossed at the knees, will your blood pressure be cumulatively higher by about like 50 millimeters of mercury? No, these are not cumulative. So, but at the same time, what I want to highlight is checking blood pressure is simple at home, but it's always all these things you have to keep in mind. So I'm just going back to the previous slide to show what you need to do. Because until you have access to a device like this, where yes, you do need to measure it once a month with a arm cuff, but at other times you don't have to do all these things because it is measuring in the background. And I'm sure these devices are going to become more and more common and more easily available all over the world so that all of us can improve our blood pressure. So no talking, back supported, arm supported, both feet firmly on the ground, no talking, no caffeine, empty bladder, relax for some time. And the next is if you are going to measure, so I'm just assuming all of you are going to measure your blood pressure at home because that is available anywhere in the world. How many readings at a time? So ideally in the previous, in the chart that was from the American Heart Association, they said you take a measurement of two, you take a reading twice, but some devices automatically take three readings. So you don't have to you inflate the cuff and you wait for the first reading. Automatically it takes three readings and averages the three and gives you the final measure. Now, not all devices do that. And so that is something you need to keep in mind. Now, if your device does not do that, then you need to obviously, at 1 minute intervals, you need to take it thrice and take an average of the three. How often? I want to say at least thrice a day, morning, afternoon, and night for a week. Or even if you measure, twice a day for 3 days, if you haven't checked your blood pressure in a long time, that would still be better than not measuring at all or just measuring once at the doctor's clinic. One arm or both arms. So ideally, you need to measure in both arms and take the reading in the higher numbers. So let us say your left arm shows a higher number than the right, then that is the one you need to take. The other thing is, do you need to check your blood pressure in the standing position? So, for some people, particularly older adults, what happens, they have something called orthostatic hypotension, meaning when they stand up, their blood pressure falls, and that can cause them to fall. And falling in older adults is a very serious problem because some of them never get up again out of bed because of fractures and whole it's a lot of it's like a cascade, of ill health. And also falling is a major risk for head trauma, and as you know, head trauma increases our risk for dementia. So falling is not it has very serious consequences, particularly in older people than in younger. So if someone has this problem of blood pressure falling when they stand up, they feel dizzy, and that can be checked. You can do that at home as well. There are lots of videos on YouTube showing you how to do it exactly. And also, this is where you need to have a conversation with your doctor if you are someone who's experiencing that, because sometimes your medications may need to be adjusted. And for older people, the target blood pressure, again, I'm not providing medical advice, but the target blood pressure may be a little higher if they have these kind of problems of dizziness because of multiple medications. Now, as you know, I'm a functional medicine doctor, so I talk about prescription medications and lifestyle change. So, lifestyle change is what I like to talk about more because that is something that you can do. Like I said, a lot of your health happens outside the doctor's office, but it is a combination of prescription medications and lifestyle change and therapeutic levels of supplementation. So I take two prescription medications for my blood pressure. Of course, along with that, I take a whole lot of supplements as well. And in the, so I have scheduled these webinars for, it is supposed to be the third Friday of the month. I know today is not the third Friday, it's the fourth Friday because I was traveling, so I couldn't schedule it for last week. So every month for the next 5 months, it's a series of 6 webinars. Third Friday of the month, 9 a.m. Mountain Time, I will cover a new topic. Next month is going to be food, which is so important. So again, out of office blood pressure measurement, as I said, which one are you going to choose? If you have the option, ask your doctor for a 24-hour ambulatory blood pressure measurement because it will check your nighttime blood pressure. If you have the option of getting an Actia device, definitely go get it. And home blood pressure monitoring, all of you can do. You just have to figure out where in your day it would fit when you can, check. So what are the differences between the three ways of measuring blood pressure? So, at the doctor's office, what happens is it's a medical setting. So, white coat hypertension, your blood pressure may go up anyway because you are at the doctor's clinic, and maybe you didn't find a parking spot or you got late in the traffic and you didn't get time to sit long enough. So, yes, it is something is better than nothing, but it is not ideal. Home blood pressure monitoring, like I said, you can check more often. That gives us much better information than clinic measurements, but it will not give us measurements at night. So, nighttime blood pressure we cannot figure out from home blood pressure monitoring. And more importantly, I just described how irksome it is to check your blood pressure at home. Now, maybe I'm the only one who's complaining. Some of you are probably so disciplined you do it regularly. So, good on you. Congratulations. I am not one of them. The third is the ambulatory blood pressure monitoring. Now, this particular paper did not use the Actia device, but I would say that the Actia device or similar devices that may come up in the future, which measure blood pressure in the background, those are going to be easy and simple. And I am 100% certain it's going to change the way we help people with blood pressure so that 1.28 billion people can hopefully become much less. And of course, more importantly, it'll help people live longer, healthier lives. And I can, I mean, I have had a few friends who got the devices from Europe. 100% it has changed their blood pressure management. All of them has. So because one of the things that happens is, and that can happen when you measure at home as well. So if you measure your blood pressure and you find that it is high, very unlikely you're not going to take some action. You're going to set up an appointment with your doctor and figure out what is the right thing for you to do. So, studies have shown that those who measure their blood pressure more often have better blood pressure control. And the reason is nothing to do with the measurement as such, it's because you're taking action based on those numbers. Next, so this is the Actia device. If you have an option, you're in Europe, you can get this, and it's fairly simple to use. Ideally, you should use it 24/7. But if you find like the actual Actia strap was, it irritated my skin, so I had to change the strap to something else. Initially, what I did is I found because my skin was itching, I decided, okay, I'm going to use only at night until I figure out how I can wear it during the day as well. So my point is, if you have to choose between wearing it during the day and wearing it at night, I would definitely suggest make sure you have a few nightly readings. Ideally, 24/7 would be the best. And there is an app connected with it, and you can get a beautiful report. This slide, and again, if you want to, you can take a picture. This image is from the American Heart Association. For some reason, why is there it is. It was behind my picture, my video. So this is by the American Heart Association and American Stroke Association. This was in 2017 when they came up with this category, because if you know, some of you, I'm sure you remember that blood pressure, for you to be called as hypertensive, the numbers were different. Now the normal blood pressure is considered to be less than 120 and less than 80. This particular chart is extremely important because Europe has different numbers, different thresholds, different guidelines. But I think recently the European thresholds have also changed and they're coming nearer to the American ones. The reason a lot of people are confused, particularly doctors, is they don't know which one to follow. And it's not like I'm just making up something about doctors. Doctors have said that in studies when they were surveyed that, what do you feel are some of the challenges why more than 1 billion people worldwide have hypertension and only just 1/5 of them have it under control. Some of them have said that we don't know what the actual ranges are that we should aim for. Again, this is not medical advice, but it is important to know if you find your blood pressure is not 120 by 80 or less, and you don't have serious illnesses, kidney disease, and all that, in those cases, you need to talk to the specialist. For people with kidney disease, heart disease, or someone who has a lot of dizziness, what are the appropriate numbers? But for others, if you don't have any other major illness, this is a number you should look at. But the important point here is in the rest of the world, outside the functional medicine world, the approach is okay, if your blood pressure is not high. Now, what happens? This is what I'm going to talk about in the next few webinars. Those people who are in this range, 120 to 139 and 80 to 89, should they be put on a medication? That is a question that you need to ask your healthcare provider, because what is often done is people are told your blood pressure is a little high and you need to stop smoking, stop eating, sugary drinks, reduce your salt intake, you need to exercise more, walk more, sleep better, get rid of your stress, as if you can get rid of your stress. Do this, do this, do this, do this, and they are sent home. And once they are sent home, they are told, okay, you can come back in 3 months. And what happens most of the time? Now, most doctors, and I am a doctor, it's not like, I'm blaming my colleagues. Most of us are not trained in helping our patients make therapeutic lifestyle changes. Therapeutic meaning which will have a positive impact on your blood pressure numbers. This is what is, you're given a bunch of information, you're told, do this, do this, do this. But there is no structured method and how you can do it. What do you mean by reducing salt? Where do I go looking for my salt? Is there a test which will tell me, how much salt I'm eating and how much I should not be eating? So those are the things that most people are not, they're not given that information, or there's no process to go through, which will help them take better, make better choices. And 3 months later, the blood pressure has not moved in any way, lower. And the doctor says, now you need to start a medication. So what I'm saying is, medications can definitely lower your blood pressure way better than anything else. But in all these, whether it's very high or in this kind of a range, the guidelines recommend, every doctor will tell you that lifestyle changes are extremely important along with prescription medications. But the problem, like I said, is most people are not told what are the exact specific lifestyle changes that are relevant for them. See, as a tiny habits coach, I have learned that I need to help people do what they already want to do, and I need to help them feel successful. These are two of the maxims of the Tiny Habits world that Dr. BJ Fogg, who's the head of the behavior design lab at Stanford, talks about. So, what do I mean by help people do what they already want to do? Maybe this is a time when you don't want to focus on, reducing your salt intake, but you are fine with increasing your daily step count. So, as a doctor, should I be telling you, no, you need to reduce your salt today? Yes, of course, you need to walk, you need to exercise, you need to join a gym. Maybe you don't want to join a gym. Maybe walking is much better for you because that is something you see yourself do more often. So, those are the things that I am excited about in the Tiny Habits method and the program that I'm going to launch in the new year. So in the world, out the other world, your regular family doctors will, unless your family doctor is trained in all these things, the only way to lower blood pressure is adding a second or a third medication. Now, some people may need more than, most people actually do need more than one medication, prescription medication. But my point is that is not the only way. Along with prescription medications, you do need to make lifestyle changes. You all know that. It's not something that I'm something new that I'm telling you. But how do you go about that process without relying on extreme motivation and willpower and without calling yourself names like I'm sure all of us do? You idiot, you don't have any motivation, you're lazy, you're this, you're that. So, no blaming yourself, none of that. I can help you with a much better process where all this guilt and, all this, that entire, all those negative feelings will go away and you will find yourself making very important lifestyle changes and be able to sustain them long term. So this is what it's important to know that, yeah, know what you ask your doctor, what should be your target range. And if your doctor is not sure and you can show this is the guideline that in North America, this is what everyone follows. Europe, it may be a different one. And the other interesting thing is women probably need lower numbers. And here is where there is a lot you can do yourself in the sense, yes, maybe you are on one, two, or three prescription medications, but if you are able to make these, lifestyle changes, add the right supplements. I will talk about supplements in one of the webinars. I think it's 3 months down the line. You can make your number one, your blood pressure medications can work better. And some of my patients have found, particularly if they've lost a whole lot of weight, they have had to reduce their blood pressure medications. Now, weight loss is a very different and a very difficult topic in some ways because the biggest challenge is in maintaining the weight loss. Because if the weight comes back, as it so often does, then blood pressure can go up again. So we have to remain vigilant about that. So what are the subsequent webinars going to be about? This is best food, supplements, what should you ask your doctor, what are the lifestyle changes, and women and blood pressure. As I said, I'm a former OBGY, so women's health is very important for me, and I'm sure for you if you're a woman and for your loved ones as well if you're not a woman. What are the things? Basically, I like to focus on things you can do for yourself rather than, all the different things that, yes, prescription medications, taking them regularly. If are you taking your medications regularly? If you're not taking them regularly, do you need to create a habit to take them regularly? Or are you someone who thinks that I'm going to live my life without any prescription medications at all? Well, then you need to probably, find out what makes you think that. Because getting your blood pressure to the optimal range is extremely important for your long-term health. You want to prevent dementia, you want to prevent heart disease, you want to prevent kidney disease, vision loss, sexual dysfunction. All these things are extremely important for all of us. And our health in our older age depends on what we do today. And by today, I mean today for anyone. So, health in our middle age or even in younger age impacts how we live into our older age. And it's never too late to start changing things. It start making small changes that can have a huge impact. So at this point, I'm going to stop recording and